And now it's time for us to have the very last conversation for today. And I just can't stress this enough. If we're talking about schizophrenia, we've touched on it before, I think, with Dr. Fyong. And many people started to ask questions about stuff that they go through. It's also some of the things listed under mental health, and then we really need to tackle that. I'm expecting to have Dr. Leanne Dede in the studios pretty shortly. But today, for the very first time ever meeting you, my lady, we have Dr. Na Ayele Mensah. She's a psychiatry resident at Kolebu Teaching Hospital. It's good to see you, ma'am.
Nice to meet you too.
Oh, okay. Well, I learned that you are the only, pilot of the ship today. That's fine. It's fantastic.
I'm taking one for the team.
Yeah, right. Okay, that's great. Resident, so that's like doctor, but not yet doctor. Is that it?
No, that's doctor already. Training to be a specialist.
Oh, okay. Now that why they say residence? Like you have a landlord or something.
Well, it's a period, so it's a residency period.
Yeah,
so
I see.
You have to go through the period. Resident at the location, learning what
Then after that,
specializing in.
To wherever you go.
Yes.
I see. I would have asked you why psychiatry, but I realize that it's very important and people always overlook it. So yes, it's a great job that you're doing. But let's get on with schizophrenia. Very nice name. It's quite difficult for some people to mention it, but I'm actually excited I'm able to mention like schizophrenia, and all the phrenias. What is it?
Okay.
Yeah.
So the group, mental health in general have a lot of diagnoses, just like the general side do have malaria, typhoid, and all of those things. Schizophrenia is one of the many mental health disorders or diseases that are treated in the psychiatry setting.
Okay.
Now, schizophrenia is under the psychosis group of mental health diseases. It's typically one that affects major functioning facets of a human being. For instance, the speech is affected, the lifestyle is affected, the way the person thinks is affected, and therefore the person could actually, at a point, hear voices, talk to them. Yes, so that is schizophrenia. It affects a lot of the functioning facets of a human being, and it's coming together is what we term as schizophrenia. But the word schizophrenia itself, it's a Latin word that means split mind. So not literally like your mind is splitting, but it just means that split mind, like the person's normal functioning or
thought
process is actually deranged or not assembling well.
Wow. But before you get to that, do you have little underlining factors that, crop up to, because you started to say that your speech is affected, and I'm thinking that maybe there are other names for these things, and then so does it mean that you have to go through like smaller diseases to get to that point of schizophrenia?
Yes. So schizophrenia, actually, the diagnosis is made when a person has had the signs and the symptoms occurring for 6 months.
Oh, right.
But a person could have signs and symptoms that last for a month. That would say the person is having a brief psychotic episode.
Right.
Then some may present with symptoms that may have lasted for 3 months, which we would say schizophreniform disease. But for a diagnosis of schizophrenia to be made, the symptoms such as hallucinations, delusions, disorganized speech, disorganized behavior, which are called positive symptoms, plus certain things that are also classified under negative symptoms, like the affect of the person, ambivalence, and anhedonia. A lot of stuff will come in. So there are diagnostic criteria, which we will get to. But for schizophrenia, a diagnosis is made after a person has had the signs and symptoms occurring for 6
months. How common is this?
Very, very common. In our setting, we see every day you could make a diagnosis.
Well, you're in that hospital.
So worldwide, the epidemiology says that when you take 1,000 people, between 15 to 19 per 1,000 stands a chance to experience schizophrenia. So if you take 1,000 people, between 15 to 19 persons out of that 1,000 could become schizophrenic or could develop schizophrenia.
Wow.
It's more in men than women.
It's more in men than women?
It is frequent in men than women. And
is it because they don't talk? Is it because they don't express? They don't go for counseling. They don't want to tell what's on their mind. They just really keep all the things, bam and so and things. So they're like literally keeping everything up. And then they start to hear voices.
It is part of the predisposing factors. But men, based on their genetics, are more prone to go through schizophrenia. Plus the things that you have mentioned than women.
I see.
Also in men, it can happen as early as the age of 18.
Wow.
For men, yes. It is after 20s for women, but in men, it is.
What causes this?
So for schizophrenia, the actual cause is difficult to tell. But a lot of things come together, can predispose somebody to schizophrenia. So, for instance, there are neurochemicals in the brain.
Okay.
Dopamine, serotonin, they are to function at a certain threshold.
Okay.
When these neurotransmitters or chemicals in the brain malfunction, it can predispose a person to schizophrenia. Also, during the stage of pregnancy and delivery, if complications come in, those things can also predispose a person to develop or increases the person's chance of developing schizophrenia.
Are we looking at, what's the name, the thing, postpartum depression?
No, postpartum
That's
depression
different.
is for the mother who carried the pregnancy.
But then this one is for the
schizophrenia
fetus.
is for the fetus. So the development and then how the labor goes. Sometimes labor is extended.
Right.
Or babies do not come as expected. So all of those thresholds can, are the extremes that can predispose a person to schizophrenia. Also, sometimes people will use substances. For instance, cannabis and all the other hard drugs.
Red and all that.
Yes, can predispose a person.
Please bring the camera. Let's see the doctor's face for her to tell them red means stop. You said red.
Yes, not red and all the other substances.
All the other colors.
Yes, can predispose a person to develop. The use of it, their use and abuse of it can predispose a person.
Use and abuse.
Yes.
Okay.
Can predispose a person to develop schizophrenia later on in life.
Good morning, young person who feels that you don't have a job and so you want to go for red. This is news for you. You could go into depression and then it goes into schizophrenia. It's a very nice name, but it's a very terrible situation. So you don't want to be there. So if you know somebody who smokes, who drinks, who is into all these substances, and they have very good excuses for it, it helps you, your brain is open so you can understand things. Someone has been solving maths since they were children till now because the only time they get to solve the maths is when they are high. Beware. Anyway, let's get back to the combo. So on the regulars,
but also there's a genetic component to it.
Okay, great.
So it runs in families as well. So there's a 60 to 80% chance that if a family member, close, nucleated, mother, father, develops schizophrenia, there's a good chance that their offspring, yes, may be in the category of the people who are predisposed to develop schizophrenia.
Well, let's get to symptoms. I know that you've spoken about depression and all of that, but for somebody who's watching us, maybe heard a lot of stuff about it. But what are the day-to-day things that we see that should inform us that we need to come to your desk?
Okay. So for schizophrenia, the symptoms that we look out for are the positive and negative symptoms. They are grouped under these two big headings.
Okay.
Under the positive symptoms, which positive mean not that it is positive
I was
or good,
about asking that.
but positive symptom meaning that those things, when are present in a person, pushes us towards the diagnosis of schizophrenia.
All right.
So that includes hearing of voices that other people cannot hear. So as I sit here, you can hear me audibly. But a person that suffers from schizophrenia may be hearing, but none of us around will hear what the person...
So who is saying that? Is it a spirit? I mean, there has to be a spiritual side to this, right? Or you don't? I know that you're a medical person, but you're Christian too. You love Jesus, don't you?
I do.
So, and if the Lord is talking to you, you could you say that it's
The Lord will give you clear instructions that we will all understand. The Lord will not tell you to go and harm somebody.
Okay,
The
so
Lord
it's the
will
devil
not
that's
tell
the-
you to go and shout or go and cross traffic lights or go and stand there for a car, stand in the middle of the road. I don't think that's how
So
the Lord
what the
told us.
people normally hear is
The things they hear, when they present it, it is not consistent with normal happenings or occurrence.
right. It's good that we cleared that out because I mean, someone can say, "Oh, I'm hearing voices." Probably it's angels singing. Then they'll start to think
No,
that.
but the circumstances are also different.
Tell us
When
about
we are in service and we call the Holy Spirit, I am not a pastor though. I'm just saying that in a service setting, we have called, so we would wait for an answer. This is happening outside. There is no service happening. The person's activity of living is what is making them hear it.
All right.
We cannot compare the two.
Okay. All right. And then what again?
So hearing of the voices, usually they hear people commenting about their life or giving them instructions. Then there is delusions,
Right.
where they see the urge to do something or they believe that something is, but in actual fact may not. So somebody might think that their friend hates them or their family hates them. And in actual fact, their friend the person may not even have offended their friend to even elicit that kind of a reaction from their friend. But the fixed thinking and belief that somebody wants to harm them it appears strongest to them, even in the face of all evidence proving otherwise. That's a delusion. Then there's the disorganized speech, where the person is talking, but as you are having conversation move on a certain trajectory.
Yeah.
So if I'm introducing myself, I'll say, oh, my name is this, my age is this, I work here, I come from here. But in a schizophrenic situation, a person will start, my name is, oh, last week I went to church. Oh, and did you see the man in the market? Oh, the driver is passing by. These are
Distorted.
Exactly. So that is the nature of the disorganization of the speech of the person who may be having schizophrenia. Then there is disorganized behavior, a behavior that may not be consistent with the person's norm or may not be acceptable in their culture or belief. Yeah. Then we come to the negative symptoms.
We should be more dire.
No, the positive is more dire.
Oh, I see. So medical people, you have been twisting things.
Well, it's not it's not as clear as it seems. So for the
Interesting.
negative, we look at the affect of the person. So
Right.
as we are sitting here, you and I are laughing. But imagine you are talking to me and
Maybe sinking. You're trying to understand.
well,
me.
for a very long period, my usual state will be that.
Okay, now that's frightening.
Exactly. So the person's affect, their look is different. Then they lose, they don't have energy. So that's anhedonia. They don't have energy to do the things that routinely they may have been doing, like taking care of themselves, maintaining their personal hygiene, wanting to eat, wanting to cook, all of those things are also affected.
Wow. Interesting. You have that in children?
Not below 18. Like I said, 18
Not,
and above.
not below 18. Okay. So if your child starts to behave a certain way, could be something else.
Could be something else. Could be a lot of something else in mental
Right.
health. So
Right.
that child may need evaluation and
Right.
and also dependent on what the child is presenting. Because for children, there's tendencies. So when the child is off or below or extreme in the tendencies, like walking, talking, I mean, you wouldn't have a child who may not be talking, describe a hallucination to you. It will be difficult to elicit certain things like that from it. Whether they are hearing voices, it will be difficult.
Right.
But their presentations, when they are given to the doctor is able to put them in a category, not schizophrenia, but other forms of childhood mental disorders.
Well, I know that I promised that you could call in and be a part of the conversation, but today we can't make calls, okay? So this is what we'll do. We'll get on our socials. It's My Dominion TV on YouTube and Facebook. I'm constantly there checking it out. See what you're writing. Ask any question at all. And we'll be sure to ask the doctor who is a resident at Kolibu. And then we'll really delve into that. So I think last week, 2 weeks ago, some people would call and, want to find, hearing voices. Some also talk about stuff crawling on their skin. Is it the same thing?
So there are types of hallucinations. In schizophrenia, the typical one is the hearing of voices.
Oh,
but there are other forms of hallucinations. So you could have what we call tactile hallucinations, where people feel that things are crawling on their skin, but there will be nothing physically visible.
So it's just their mind telling them something is crawling on their skin.
Their mind, yes, but also they feel that something is crawling on their skin.
And what is that?
What is what?
What's crawling on their skin?
It's a hallucination. And then there is visual. So people may see things that may not be there. So they'll tell you, oh, this and such is here. But as the rest of us are here, we don't share in the hallucination. So we may not be able to see what they are seeing. But they are confident that they are seeing what they are seeing. And it will be difficult for you to say otherwise to what they are seeing. So there is visual, there's auditory, there is tactile, and then there is also smell.
They smell things differently?
They smell things that you may not smell. So the person may smell that the person may think that there's an awful smell or foul smell, but other people may not perceive it. But with the person, they perceive it. Usually, they may perceive the smell of a dead something. Yeah, that kind of awful smell is what most people may be experiencing. But around in the same place where other people may be, they may not smell it just as they are, but they strongly have the sense of smell altered.
These people live in communities, live in family, live with people. I'm getting to support system now. What do we do at these stages if you are around such a person, your parent, your guardian, your sister, brother, or you probably live in church with that person of whom their immediate family maybe would just overlook these things? How do we start to address these issues?
Okay. So for people living with schizophrenia, they trying to let them see reason may not work. So if there's somebody that can communicate to the person, communicate not as in understand what they're saying, but they listen to you.
Okay.
So there may be that one person that the patient or the schizophrenia sufferer may heed to.
Okay.
Most of the time, their pastor or some auntie or uncle, that person has to get the person to a point of treatment. So a point of treatment is psych care.
All right.
Whether Accra Psychiatry, Pantan, or Kolibu in Accra, and then there's the Kumasi Center at Konfanoche. There's also Ankafo in Cape Coast. And then there's also psychiatry in the Cape Coast Teaching Hospital. So you get the person to the point of care. And once they are at the point of care, the needed assessments will be done. If a diagnosis is clearly made, medications will be applied. The person may need admission. If they need admission, the person will be on admission, be assessed till the time that the symptoms are in remission. When the symptoms are improved or in remission, then they would be brought home to the home setting. Now, home support, when they have come out of care, is also important because compliance of medication is really needed. We need the patients to comply on medication. Most people get home, they do a few days of the medication, then they say, I'm fine.
But they are fine.
I don't need the medication again. Or they become preoccupied with the complications, possible complications of medications, and then they stop taking their medication, what we would call default or refuse medication. And once a person is not on the medication, their function would revert back to the initial distorted one that is problematic and difficult to cope in society.
So do you have training sessions? Do you have, a way to get to the people who offer help during maybe the schizophrenic episodes and all of that, so that they in turn don't lose their sanity?
So when you come into care, there is not just the psychiatric care, there is clinical psychology and counseling. And in clinical psychology, we do cognitive behavioral therapy. And then other forms of therapy, family therapy, where we let the family know what the patient is going through and what they can do to help. So patients, usually, we would involve family therapy in their care. So when family members avail themselves, they will know the cause, the reason the person may be having the symptoms that they're supposed to, adherence to medication, all of that is done with the psychologist in therapy before the person is brought back to the home setting for reintegration. So yes, they are, because psychologists are present and you need to book an appointment with them. But in the course of care, when a patient is on admission, we make sure that at least they do get the counseling that they needed for the people who are significantly going to live with the person. And even sometimes to the point that somebody is responsible for their medication. So that person will also know when, how to give the medication and what to do when they notice a few things that are distorted.
Well, Dr. Fiong is sending us, good morning, Dr. Fiong. I hope you're well. He says on YouTube that God's voice would never contradict his word. Yeah, so it couldn't have been the prophet hearing the voice of God. If a voice tells you something contrary to the Bible, especially involving fear, harm, confusion, and self-destruction, it's not from God. Then we need to. So God will not tell you to go and cross red lights and then stand there and look pretty or or stuff like that. So you want to be and don't go and be saying that somebody maybe saying stuff that are not there, right? We can't just easily just say that, okay, the person is schizophrenic because he's saying something that's not there. Could be something else, right? Yeah. So that means that we don't have the right.
So it's not also just about hearing the voices. So if it was only about just hearing the voices, it wouldn't be a problem. But it's a set of things. So yes, they are hearing the voices. What are the kind of voices they are hearing? 1, 2, what is the voice telling them? You look through that. Then you come to delusion. Does the person have a delusion? How is the person's behavior? How is the person's speech? So there are a cluster of things. It is not just about hearing voices.
Okay, so there you have it. It's not just about hearing voices, okay? So there are many things, and so you can't just easily judge that, okay, this is a schizophrenic case or something like that. That's why we're advised that the moment you feel, okay, there's something that's off, you start to talk to the person, start to see where the mind is at. And then you, first point of call, Dr. Fion always says that what the mind sees, the eye sees what the mind knows. So the moment you start to see, all these things, you want to get to a health facility, you want to ask if they have, all the hospitals that she mentioned, probably you might not have that in your area.
But there are, now mental health is decentralized.
Okay, so we can go to any hospital.
Community psychiatric nurses. There are Also, units, psychiatric units in polyclinics, district hospitals. You would meet somebody that will give you the psychiatric care. But if you may need admission, then you will be sent to these bigger point of care.
All right.
But any of the polyclinics, district hospitals would have a psychiatric nurse or a psychiatric community nurse in the unit who would go through the assessment, the initial assessment. If it is beyond them, then they will refer.
I see. What are some of the lifestyle interventions that we can do to support schizophrenic patients?
So, to support the patient, we would need to make sure that they are attending their reviews and they are taking their medications as recommended by the doctors.
So exercise and food all those?
We'll come to all of that, because if the patient doesn't take the medication and becomes stable, your exercise will mean nothing.
So that's the first point of call.
That's the first point of call. Get the person care. Get the person on medication. That will support their constant well-being. When they are down to understanding life and the normal things from the abnormality, then we will do where the person will live. Family should identify the triggers. Patients, most of the time, people go back and the reintegration is the problem.
Right.
So person has had a mental disorder, comes home. How do we treat the person? Do we treat the person the same way they are used to prior to the diagnosis? Or now, because of the diagnosis, we are giving them a gap. We are making them feel like they have a diagnosis, and therefore certain things we may not let them do. We are not recommending that when a patient comes from admission, give them cooking assignments, but involve them washing dishes. If you are cooking, they could wash your vegetables for you. They could wash the bowls. Also exercise. Involve them in walks. I mean, every condition, once you do diet and exercise, it's a good, even if it's not physically affecting the person's physique, it is a time for people to bond. When people do these keep fit clubs, beyond the exercise, there is bonding,
love.
There is feeling of love, there is contact, there is connection. So isolation in mental illness in general is not recommended. Person is not supposed to be isolated. Person is supposed to be allowed to live their normal life. Our job is to make sure that they are getting the care and they are getting the medication. Once they get the care and medication, they are good. All the other things, they can function like normal as they used to be.
So do you get to advise
and avoid stigma?
And oh yeah, right,
and,
right.
Branding or tagging.
Tell me the difference, stigma and branding. I mean,
no. So stigma is a prejudice that we all. It's something that we perpetuate on other people. So we treat people differently because of a tag, or we do not associate with them because we think that they have gone through something. But if I tell you, oh, diabetic, or papa no was schizophrenia, or mama no was depression, that one we are labeling the person.
Right.
And it's part of stigma, but it's labeling.
I see. I see. So, I mean, this could happen to you, right? It could happen to anybody.
It could happen to a doctor, a pastor.
No, I don't want to go to the pastor side, Jesus, because I don't know then what you would tell your church member if you're going through that.
It's.
Have you ever had a situation like that where a pastor is your patient?
So, confidentiality issues, but schizophrenia, all I can say is schizophrenia happens to everybody.
It means that
every occupation.
You've encountered that.
Everybody,
before.
Every occupation.
Yeah, so getting to that part, do you have the chance, or are you allowed to advise maybe in a job change, for these, people who have gone through that? I'm thinking some people's maybe occupation, the stress of it also might be a trigger. So then when you notice that, are you able to advise employers and all of that?
So yes, one of the beautiful things about psychiatry is we don't just give medication. We look at all facets of life. So when a person has a diagnosis, we look at family, we look at work, we look at lifestyle, all the things that are contributing to what the person is currently suffering comes to play. So if a person cannot function based on assessments from a psychiatrist and a psychologist, that the person cannot function in their previous role, then the psychologist will reorient the person to understand that as it is happening now, you need a change of role. Because yes, the company can change the person's role. But example, myself, if I go to the hospital and I'm told, oh, you can't work because you have schizophrenia, that alone is a trigger for me to go back. So if a psychologist explained to me that currently, because of such and such, it will be difficult for you to function in your previous role, can you think about something that you can do differently? So it is not like I feel stigmatized. Because when I go back and you tell me not to see patients, I'll feel stigmatized. But it may not be in my good interest to see people because I also am dealing with something. However, there is times where change of function may be recommended depending on the state of the patient. So the patient, their presentation, their rehabilitation would inform if there should be a change in their function or portfolio.
I know you're trained for this. I mean, Dr. Dede, I mean, fantastic lady at this. And I know that you have many doctors, nurses who are good with this. Dealing with these issues, aside the fact that you're being trained for it, does it affect you?
To an extent.
What extent?
They are human like us. They are probably, could be our relatives. So you identify with the person, you come into contact with people. If they are a lady of your age, your heart goes out to the person that they may have been going through something. And also sometimes even the circumstances that has led to the person experiencing the mental disorder will give you a lot of things to think about. But it will not physically affect your function towards the person. But it will give you a lot of things to think about. And it will also inform how you would treat the patient, what you will apply. Because patients are not the same. You can't apply the protocol to everybody. There are some people you need to loosen up. There are some people you need to tighten up. There are some people you need to go down to the level of treating them like a child, or before they get to the point where they can come back to be at par with you in thought as an adult. So it does, because we are humans, we are emotional, and we feel for our patients. We feel for people who go through things like that, because we have the backdrop that anybody could have it. But it does not affect us to impact on our care. But we're human. We do have these emotions. And yes, our heart goes out to our patients. We consider that our patients are real human beings going through real situations.
I see. Well, for people who would use money as an excuse not to come, what would you say to them?
As in, they feel it's expensive. They don't have money to come.
They don't have the money to come. Aside the fact that it's decentralized, you said it's in all hospitals, but I mean, the going cannot be going until something pushes you.
Exactly.
Right? So people have the idea that certain things are for rich people. Leave it for rich people to attend to it. If you feel you have a problem, you can go and take herbal medicine. Don't go to the hospital. You know, all of these things. How do you address that?
Okay, so there are genuine people who may not have financial
capabilities
or capabilities. That one is different. But I don't think you go to any hospital and try to seek opinions and they would turn you back. So even if you don't have the money, unfortunately, mental health is not yet on health insurance. But in the polyclinics, I know that you would first go to the general side. So your insurance will take you to the general side. A general doctor will listen to you, then recommend psych care.
Specialist, yeah.
Even the general doctor will not let you go without giving you a prescription. So it's not an excuse. Maybe coming to a point of care for psychiatry, you may complain. But if you take your health insurance and you go to a general hospital and they assess you, let's just say you don't believe that it's a mental disorder. You go to a general hospital, your health insurance could let you see a doctor and then a diagnosis will be made. Then if you are referred, then you will take it up. But even when a diagnosis is made, the complaints that you are presented with, the general doctor will give you medication. So if you can't sleep, they'll give you medication for it. If you're hearing voices, they'll give you a prescription. Because every doctor does some sort of mental training, psychiatric training. So every doctor goes through psychiatric training. So there's some knowledge, only that the psychiatrists are specialists
to deal with that
issue. So some first aid, let me put it in that category, some first aid could be introduced for this person. But progressively, the symptoms get worse. So it's really, I wouldn't encourage the person to say they don't have money, so they are staying. Because the more the symptoms get worse, then the care and the prognosis
becomes a lot even expensive, right? I see a mental health line.
Yes.
On your shirt. You want to run that out real quick?
Oh, okay. So
for families and friends who feel like you need to call, you need to, let me just mention that real quick, 0800 678 678. Oh, easy. 0800 678 678. So if you need to call a facility, you need to maybe do real quick checks. Okay, can I bring this person to the hospital? Where can I go? Who do I speak to? And all of that, you can just call 0800 678 678, right? And that's how you get that done. And when I was asking you the last question, I spoke about herbal medicine. Is it advisable?
For now, I don't know about any herb that is meant to cure any mental disorder.
Okay.
So that's it from our end.
Yes, let's leave it there. Let's leave it for that. But if you have any issues, don't start with herbal medicine. Don't start with self-medication. Don't say that, okay, Kojo in the other family started experiencing this and this is what they did. I mean, every patient is unique, right? And so you want to call is 080 678 678 and want to ask the regular you want to ask questions and you want to know what is happening, where to take the person to. And you also want to be a good person to be a listening ear to such people. Don't just go ahead judging people. Why are you too quick to judge? Akwesi, stop that. Yeah, so thank you very much, Doc. This is, let me get doctor's name right because just in case I make it to Kolebushu, now say I didn't mention her name was, so she'll give me wahala.
That will not happen.
Dr. Nayele, Mensa, psychiatric resident and at Kolebu Teaching Hospital. Let me take your last words before you go. Anything you want to say to our viewers before we check out?
So my last words will always go in favor of psychiatry and mental health. Mental health is real. Mental health is happening everywhere, in our communities, in our families, in our homes. Be a person that supports mental health care. Let's avoid stigma. Let's support people to get care. Let's encourage them to get the care that is needed. And if you are dealing with a mental health problem, know that you are not alone. We're here to support you. We're here to listen to you. And if you have a family member or you are a caregiver of a person that is living with mental health, know that it can only get better from here. You are the real MVPs, and we are proud of you.
Oh, that's really nice. Well, you are the real MVPs, and we're proud of you. You heard the good doctor, so don't go about judging people and all of that. Well, at 12 today, good things are going to be happening. First off, is judgment against unrelenting enemies. That's going to be our prayer focus on 1 million strong today. And Reverend Perpetual Eduse is going to be taking us. Reverend Perpetual is such a great minister of God. So you want to be a part of today's service. You can join Global 1 Million Strong, either on Facebook or YouTube, or you stay glued to Dominion TV. and be part of this prayer. Look, to pray it shouldn't even come as a chore anymore, because look, you can't live, breathe, move without it. You don't know what's happening 2 minutes away from what's from your current time, okay? And so you always need to pray. Jesus says that man needs to pray lest they faint, which means for every minute that you don't pray, you're fainting. So get on with 1 million strong and get praying. And I know that God is going to answer your request. And also you shared testimony with us on Friday. Same 1 million strong. All right, so this is where we draw the curtains for today. My name is Precious Biadala. I will see you tomorrow.